and good morning. I'm Dan Peddycord, the department head for Public Health, and you all know, should well know Dr. Marty Fenstersheib. I want to welcome you to the kickoff of our journey to accreditation. And if you can't tell by the imaging and the posters and the music, we're really excited about this journey. I want to start by sort of asking who's here. Who's here from admin? Raise your hand. Pharmacy? Yay! Lab? EMS? Health? Yay! Wow. You guys all stick together. I'm worried about that. You guys be really worried about that. I already asked EMS. Public Health Preparedness? Did I already ask that? WIC? Who's here from WIC? Yay! Vital Records? The ID team, the larger ID team, which is CD, TB, HIV, all you guys, IZ, big team. Public Health Nursing? Awesome. You guys are kind of together too. How does that happen? I know. MCAH team, which is kind of Public Health Nursing. Anybody here from team? BIH? Yay! Who didn't raise their hand? Okay. Lab? I forgot the lab. No, I did that. Who did I forget? CDIP. Oh my goodness. Who's just here? Oh yeah. So again, I want to welcome you all this morning. This is just a very exciting journey that we are about to embark on as a department. Marty and I are going to kind of tag team here in the early part of the presentation. Then we're going to do a slideshow. We'll do a little video clip. We're going to do a game show, believe it or not. The goal is to really get you all enthused about this journey. It's something that's going to involve all 425 plus or minus of us. And if it doesn't, you should ask why. And you should hopefully leave here today with a little clearer understanding of why we're embarking on this journey, how it involves you, and what we're going to get out of going down this course. So I'll turn it over to Marty.
Okay, sounds good. Good morning, everyone. Does everyone know why you're here? I don't know. This is American Idol auditions, right? You do know that. Yes. Okay. We have our first contestant over there. Now, so we're gonna talk about accreditation. Has everyone heard about accreditation? How many people have not heard about accreditation? A couple. Okay. So most of you have. So today we just want to make sure that you know where we've come, where we're going, to get inspired, to get knowledgeable, so that everybody is on the same page for what public health accreditation is. And we have a tremendous team that we'll introduce in a little bit that will then take us on this journey today.
So you know the good news here is that you guys get to hear this first. The bad news is we're going to practice on you. So hopefully this afternoon session we'll get probably a little more refined version of this. But so what is accreditation? We're going to do a slide presentation in a few moments that'll get a little more into that, but sort of in a nutshell, there has been a conversation going on in public health for some time to really define what public health is. And it's sort of why I asked us all to raise our hands this morning, because all of us define what public health is. And then there's a whole group of folks we didn't mention, including environmental health, water districts, and other partners that are actually part of our extended family. But this ongoing, nearly 10-year-long dialogue about what is public health has resulted in the 10 essential service model of public health. And then on the heels of that, some great thought leaders across our nation said, you know, as we're now beginning to define what public health is, we ought to think about establishing standards for what public health is, so that in the near future, when we say, if you've seen one health department, you've seen one health department. We no longer will ever have to say that again. We're going to be able to define what public health is, establish standards for our own discipline. And so the journey to accreditation is in large part our commitment to really going after those standards, defining what they mean for us, documenting them. This isn't just a journey of documentation, by the way. This really is a journey to commit and submit to meeting some really high standards for what public health is. And I'll transition back to Marty.
Okay, sounds good. So, excuse me, I don't have the flu, but I do have some other yucky virus thing. But I'm not contagious, so don't worry. So we're working hard to become one of the health departments in the country that does get accredited. It's something that's totally voluntary, but we're stepping up and we're going through this process together. And as Dan said, it's not something about just having everybody document everything and put it in a bunch of binders. We're really looking at quality improvement and performance. So we really want to do the things that we do better and to figure out the things that we don't do and make sure that we are, so that we do meet these national standards that are just in the process of being put together. So again, at the end of this, and we'll talk to you more about that all this morning, we really want, it's all about performance and quality improvement and being the best health department that we can in this state and in this country if we can.
So why are we doing this now? There's a couple, I think, really good reasons. Santa Clara County, and particularly its health department, has always been a leader in this nation. And so it should be that we are among the first departments in the nation to really become accredited. And certainly, hopefully, we'll be among an elite few on the West Coast that become accredited. But it's going to be an 18 to 24-month journey to get us there. It's not something we just do overnight. National health reform and what that's really about, sort of in a nutshell, this nation has realized, and many other parties in the health delivery system are talking about, the fact that we cannot spend our way to health. We can't just invest in the delivery of services and ever hope to achieve health, particularly in a cost-effective way. We have got to invest in prevention. We've got to invest in population health strategies. And guess what? That means public health. So our journey to accreditation will, in many, many ways, help really refine the value of public health, the value of prevention, the value of working with safety net communities.
So everyone is involved in, we don't leave anyone behind in looking at accreditation. It affects everybody. It's not one program over another program or one division over another division. It's everybody. And everybody has to be involved and motivated and inspired by all of this. Otherwise, it just won't work. We want you to be proud of working in public health and proud of being part of this process. So I was asked to say that over the next 45 minutes or hour or so, we will, for you, define accreditation, help everyone understand the process that we're going to all go through, learn how we will prepare for accreditation as a department and as an individuals, the who, what, when, where, why, and how of public health accreditation, and the next steps for our agency as we move forward.
So before we get into the formal program, I just want to thank a handful of folks who really put all this together today. So first of all, there actually is an accreditation team, sort of the anchors of helping us move through this journey together. Rocio, and maybe you guys can just stand up. Rocio, Maritza, Sonia, and Alelia, Whitney, and Marcella. So just please a round of applause and thanks to these guys. And then a lot of this amazing imaging, the video stuff, the really stuff we hope will get you enthused about this journey is thanks to an amazing communication team. It's a small team of 4 folks that involves Ray, Amy, Johanna, and Danica. Could you guys stand up, please, if you're here? Stand up. Very well. So thanks to those guys, too.
So that's the introduction. So as we say, let's put everything out there and let the show begin. Turn it over to the accreditation team. Thank you.
Thank you.
Okay. You know, it helps to read the notes before the meeting because I walked in and kind of found out that I'm doing this. I actually thought that the accreditation, the team that I just introduced was going to do this part of the slide presentation.
Dan?
Yeah.
We're having a little technical, but now you're coming through.
Oh, now you tell me.
Okay, now for our first.
Yeah, now for our first game show question. Exactly. Who wants to do the first audition? Talent show. Okay, there we're going. I think we're going. Are we good? We had, what, music and... Okay.
It's just weird.
So, I'm going to kind of talk this way, which is going to be a little bit awkward, but I want to look at my slide presentation while I do this. So we talked about, you know, why are we going down this process of accreditation, and what do we get out of this? Because it is going to be a fair amount of work for a lot of us. And it's going to be a long-term commitment. It's not something that we just do, hang a plaque on the shelf once the formal accreditation team from the nation, the formal Public Health Accreditation Board, which has been recently created, will come out and actually do a site survey at some point in time. And if we sort of pass all the standards that they're going to look at, we will get accredited. And that accreditation will be good for a 5-year period of time. But that doesn't mean that the journey is over. We're making a really long-term, kind of a forever commitment to the tenets of accreditation. And Marty spoke to the fact that this really is about quality and performance. It's asking ourselves as a department and sort of as a discipline, how do we know that we're doing a great job? How do we know that we are really contributing to population health improvement? And going down the rigors of answering those kinds of questions will really, I believe, help us better sell the value of public health, particularly in the context of health reform, when we have a nation that is, frankly, paralyzed over how to improve the health of the population and do it cost effectively. Because this multi-decade-long strategy of spending more and more and more money to treat illness isn't helping the nation get healthier. That doesn't mean it's unimportant to treat illness. That doesn't mean the safety net system is any less important whatsoever. But what it does mean is that we have got to invest in prevention in this nation. And we believe that public health and local public health departments are the best leaders to do this, particularly at the local level. Next. So we talked a little bit about the triple aim of health reform and why the context of that is important for accreditation. Because the Affordable Care Act, or as we know as commonly as health reform, is, I think, the most significant lever for public health in certainly my lifetime. Because what it's saying on a national level is we spent too much money, we're not improving the health of the nation. In fact, there's statistics out there that say our children will live shorter lives than we do. When you look at some of the factoids around diabetes and obesity, it's scary. You know, the notion that 1 in every 3 of our children born today will potentially grow up with diabetes, 1 in every 2 of our Hispanic children, that is unacceptable. And we cannot spend our way to treating that sort of illness and hope to achieve health. So the triple aim of health reform is said to the entire delivery system, which is way on the other end of the continuum of public health, because we're way up on the upstream end, or we're trying to move even more upstream. But it's said to our partners downstream, where about 98% of every dollar is spent. It's said this strategy isn't working anymore, and we've got to take a hard look as a whole nation at moving these investments more upstream, and that's public health. And it just so happens that our own health and hospital system has really sort of gone through a shakeup in the last year or so, and really said, you know what, if we're going to really aspire to health reform, we've got to have a strategic plan as a system. And Renee Santiago, who, if you're around here about 1 o'clock today, he's going to make sort of a cameo appearance to say hello. And so if you miss him, I apologize for that. Renee comes to us from San Diego County. He's a great leader. I'm really excited that Renee's on our team. He's been here about a year now, because he understands public health. In San Diego, he actually ran that. They sort of have to our environment. And so we think we can apply public health approaches and methodologies to address those sorts of things too. So another reason we're going after accreditation, and I mentioned this a minute ago, there's been, more than a decade-long journey and conversation led by, APHA, NACCHO, the CDC, many large local health departments, including our own. Dr. Fenstersheib is actually one of the thought leaders in this nation on this whole journey, really to help define what public health is and to develop the 10 essential services, the 3 core functions of public health, sort of around that circle on the big wheel on the outside are the 3 essential services: assessment, policy development, and assurances, and then on the inside of the circle, sort of in the slices of the pie, are the 10 essential services. But the accreditation process actually asks us to look in each of those 10 domains, and then adds a couple of additional ones like governance and an organizational structure to it. But we'll be evaluated based on how well we're performing in each of those 10 areas, and then a couple of additional ones. And are we transitioning to you on this one, Rocio? Remind me. You only got one. So am I doing this one too? I told you we're going to practice this guy in front of you. So these are actually the 12 different domains upon which that accreditation group, I think it's a team of 3 to 5 folks, will come out, spend a number of days, if not a week or so, with us in probably in late 2014 or early 15. And they'll sort of take a really long look at how well we're doing in these 12 different areas. And you'll see that, it's a pretty broad swath of activity. It's everything from workforce development to how we run the department administratively, our governance structure with our board of supervisors, how we investigate diseases, how we assess and report on health findings and health profile work, and everything else in between. One of the things that I'm also kind of personally excited about, there's a section about public health laws and a section about policy, and it's the recognition that we can really improve health through public policy. Because frankly, it's public policy that shapes the environment. It's public policy that decides whether we're going to build, bike trails or bike highways, right? Like they do in Holland. They don't just have bike trails, they have bike highways. People don't drive over there, they ride on their bicycles because they have an infrastructure. They've created public policy that enables that. And so those are the kinds of things that we can bring to this nation as well. And we have a number of great examples where policy's been a leader. Immunizations, water fluoridation. In fact, Dr. Fenstersheib is, again, been on a multi-year journey to bring water fluoridation to this county, and he is at the point of near success. They've had some great strides in the last year that he's really contributed to getting a group of folks together to commit to financing water fluoridation in our county. So he could talk more about that in a minute or two. I thought this was your slide, so it also reminds me that, I guess I'm in this presentation. It reminds us, this journey to accreditation reminds us that we're not alone. And again, when I remarked earlier that if you've seen one health department, you've seen one health department. We are on the cusp of changing that forever in this nation. When you've seen a health department, you'll be able to define what a health department is, particularly those that are accredited, those that have submitted to the standards and the rigors of really those 10 essential services. And it reminds us that we are not alone. We are surrounded by an amazing group of colleagues, and particularly here in the Bay Area. Coming from a smaller state and a smaller health department before I joined all of you, I just relish in the depth of team that we have in the Bay Area, particularly in California, and in the nation. And this is sort of just some of the larger players in this on the national front. A lot of those folks will be familiar to you. The Robert Wood Johnson Foundation, as you know, is the foundation of the Johnson & Johnson Company. And they've been a major financial sponsor to this effort, as has the Robert Wood Johnson Foundation. So, but in a nutshell, what accreditation really is about at its heart and soul is quality and performance. And so all of those 10 essential services really lead to us submitting to a high quality product at the end of the day and asking ourselves, can we do it better? And never being satisfied that we're there. I mean, that's part of the excitement about quality assurance. Quality assurance to me isn't saying, oh, you did that wrong, oh, you should be accountable for this. It's about saying, hey, we are never, ever satisfied that we're doing it good enough. We're always going to be on a journey to do it better, more efficiently. We're always going to be on a journey to work for new partners with the goal of improving population health. Never lose that thought. All of this effort is about improving population health. And whether the population you work with is WIC or CCS or in the EMS community, you do have some sort of semi-defined populations. Those populations matter, and they are large enough cohorts to actually influence overall county health statistics. We talked a little bit about collaboration. The journey to accreditation to me is also exciting in that it causes us and gives us pause to think about new partnerships, academic partnerships, nonprofit partnerships, delivery system partnerships, and that's actually a little bit of an awkward journey for us because we see ourselves as a discipline on a whole different end of this continuum. And why are we spending so much time? Why is Dan constantly talking about the delivery system? Well, they have 98 cents of every dollar. And the very fractional parts that comes to public health is minuscule compared to what we really need to invest in population health in this nation. And because of national health reform, that entire delivery system suddenly is actually going to be financially incentivized and penalized if the populations they serve's health is getting worse. If readmission rates to the hospital don't get better, that is, You know, Dan had a heart attack and he was right back here in 20 days. Who dropped the ball? It ain't just Dan's fault. It's the delivery system's fault, and we're going to penalize you. So suddenly you've got a whole delivery system, again, with more than 98 cents of every dollar in their pocket, basically. And that includes the insurance companies and how they flow through money out to delivery system partners. All together on the hook now for population health improvement. And yes, their populations are their count of lives or the number of clients in their medical home. But it's still large enough cohorts to matter to us. Because the things that we do in public health, whether it's tobacco prevention, water fluoridation, seat belts, retail licensing for tobacco smoke, a sugar tax on sugar-sweetened beverages, that's another sort of controversial but really important strategy. All of those things actually improve the health of those cohorts. But frankly, we need the delivery system's resources to help us move a little more upstream. And finally, because of National Health Reform, they're starting to think about, wow, public health has something really significant to offer. It also improves communication because we are committing to continuing to work with all of you. You've seen, you know, we're going to do a kind of a wonderful game show here in a minute. You've seen the posters. You'll see another video clip before we let you go today. But really, this is a commitment, a long-term commitment. We're not going to start something and not finish this. We're going to commit to following through, which means that we're going to be doing a lot of communication. And I mentioned, and I recognized a few minutes ago, this amazing, small but amazing communication team we now have in the department. I mean, we couldn't have had more luck in finding just an outstanding team. And, you know, Danica, Johanna, and Amy Cornell, and under Ray Waddell's leadership, have really taken the imaging here to a great level. I'm really excited about this, but you know, we're going to talk about it at staff meetings. You're going to be drowned, frankly, in accreditation, and so I hope you like the taste because you're going to get the flavor kind of day in and day out constantly, and that's a good thing. From time to time, if you sort of lose sight of why are we doing this again, please ask, please be involved. You know, each of those 12 domains that we mentioned have individual work groups. If you have particular interest in those, please talk to your supervisor and manager about how you can be involved. Ask your supervisor or manager about how does this translate back to my program? How does this involve us? And we should have answers to that, for sure. So, you know, this is just, again, a summary of the top 10 reasons. And I think I turn this back over to somebody else at this point. Don't I? No? I'm still on? I should have read the clip. This is scripted. It is. I told you guys, you're lucky because you get to be here first. You get to get back out of here early today, probably. The bad news is you get to hear it first. So, let's do that again. I'm going a little fast. Okay. You keep going? It's not, oh, it is working. I'm sorry. Probably went through that one. And now I'm doing a little bigger flip.
This is an overview that we produced here in our department of the accreditation process. And there's going to be 12 additional videos. There are 12 additional videos, one for each of these domains that you'll be seeing in your programs as we roll them out, maybe once a week or once every couple of weeks. So this is the...
Did everybody hear Ray?
No.
So I'll repeat that real quick. So this is an introduction to what will be 12 different vignettes. Each vignette focuses on one of the 12 domains. So this is the sort of introductory, or the 13th, the starting one. And so we hope you like this. I think hopefully this will also give you a really warm, good feeling inside and make you be very, very proud to be part of the public health team. audio that goes with this. I think they're trying to get the audio up and running.
And
I really think this is the beginning of a new chapter for public health. I mean, we're just starting to write the story. Health accreditation is fundamental to our future. We're trying to refine what we do so that we can really tell the delivery system that we have something very powerful to offer.
we do so much and we do such great work. It would be nice to see that that is being validated in a different way and showcased in a different way. So I think that's going to be very inspiring for me personally as I continue my work. I think the accreditation process is very important for public health. I think it's going to allow us to have more credibility. I feel like the credibility is making sure that public health has a very strong reputation out there in the community, that we are seen as experts, and that we really do know how to support the community in becoming healthier.
To work with a department that is fully accredited would be great, because then I would know that we are working with best practices. We are going to continue growing as a department.
I think we do a superb job. Our work is fantastic, but we don't have it documented and measured in the way it should be. And I think that what's exciting about accreditation is we're going to be able to document and show what we do.
I think the accreditation process will let me be even more instrumental. It raises a bar. Perhaps it lets us stand very proud that we are up to date, that we can be confident, that we have the information that will be helpful in making a huge change. We're working with a lot of different people who look to us as leaders, and I would feel so strong and confident to lead them and to support them in making even more significant changes. I think it would just give us a lot more strength to do the work we're trying to do.
I'm very excited about the accreditation process. Once that infrastructure is in place, it can endure and really change communities.
We're uniquely blessed in Santa Clara County. Despite being nearly 2 million strong, it still feels like a community.
Whatever one studies here is very important nationwide. Since we are so diverse, this is probably the nation is going to be years and years from now.
Accreditation will really support the work that we're doing as a county. It empowers us and it empowers our community. It's a group effort, and we're bringing together all our resources, and being accredited will help us serve as a better role model to our community.
We want to be able to provide the services to the family and be convenient to the families. It's the way you can make a difference in a child's life.
Public health is at the center of helping drive a transformation in our nation's approach to really improving health.
The accreditation process is a difficult journey, looking for areas that we can improve and building that so that we come out with something very valuable.
So there again, this is one of those that kind of tug at my heartstrings. It really does feel wonderful to be part of a community that really is at the center of transforming the health of this nation. You know, I've said probably to the point of nauseam that we can't treat our way to health. We can't spend our way to health. We have to invest very differently. And public health offers an amazing compendium of solutions to help drive health improvement in this nation. And so, again, our journey to accreditation is to really sharpen that message, to reach out, create new partnerships with folks that suddenly now are interested in population health, and really offer them parts of that compendium and sell it to them. You know, we're going to be working with nonprofits, with academia,
with many of our traditional partners and hopefully some that we haven't even thought of yet. But all 425 of us are going to be part of this journey together. And it's going to take all of us working together to get us there. There are going to be moments, I promise you, where you wonder if we're making any progress at all. Why are we doing this at all? Doesn't seem like we're going anywhere. Push through those moments. You know, put your doubts aside and push past them. Because without us doing this, without public health as a national community going down this road together, this country is truly headed for a health disaster. And, you know, folks who tell me, you know, there's this train ready to derail, I think haven't been watching the train tracks. It's already derailing. And it's public health that's going to put that train back up on its track. It's public health that ultimately has always cared about health equity, health inequity, health disparity. And we have strategies, great strategies to rectify that. And so this also is part of our journey together. Remind me where we transitioned from here, Marcelo? So I think at this point I get to sit down, right? And hand this over to other members of our team. Somebody nod yes. Okay, I guess I get to read this. It's because none of you can read, apparently. This will be one of our first workforce development tests. We're going to teach everybody how to read. So Dan doesn't have to read off slides anymore. So I guess we have 3x5 index cards, and we're going to collect those. We're going to be rolling out the other 12 videos. So the introduction that you saw is this month's introduction. I think in February, isn't that right, Ray? We launched each month a different domain, a different video clip, so that over the course of this next 12 months, basically in all of 2013, you'll get a chance to see all 12 domains. We do have them collected on a common drive. We call that the P drive. We want to make sure that all of you get access to this somehow, some way. The whole volume of video clips will probably crash your computer, and we'll get blamed again for crashing the county system. So we don't want to do that, but we want to make sure you guys do have access to these throughout the course of the year. You'll be getting updates from Marty and I, and Rocio, and many others that are part of this accreditation team. And from time to time, we're going to also ask you as individuals if you'd like to say something and sort of get it out to the entire membership of our department. So, you know, this whole idea that we're going to do sort of really laying on you a lot of communication about accreditation. You're going to be swimming in it. And those updates will include opportunities to get involved. And again, I want to just make a solid commitment to my entire health department, all 425 plus or minus of us, that if you want to be involved in this, you're going to get involved in this. In fact, in some soft ways, if we don't have all of us involved in it, we're really not going to get there in quite the same way. So by all of us being involved, we go through this journey as one team, as one public health community, and no longer will we ever have to say, what is public health? It is many, many different things, many different faces, and it defines us. And there'll be new things we take on in the future that help further define and refine what we are. Trainings. Does somebody want to talk to trainings that I don't know as much about that particular thing? Marcella or Ray? Anything you want to say on that? Is this about each of the domains?
There'll be forthcoming trainings. We'll be rolling out later on some quality improvement, some workforce development.
Oh, good point. So, you know, I've mentioned a number of times that really what anchors all of this is quality and performance. Delivering something, you know, having a real product in public health. And so there'll be some trainings about what does that really mean? We do a lot of stuff already, but what are we really talking about in terms of quality assurance? Just as a footnote, the department doesn't have a quality assurance plan. Many of your programs do. In EMS, for example, I don't think you guys go through a minute of your day where you don't think about the quality of what you do and sort of assess that. And you know, CCS has a quality plan, WIC, nursing does, so lab, pharmacy, so many elements or programs in the department do, but the department overall doesn't, and this is going to change that. We're going to be really looking at quality and performance as a whole department. So we'll get some trainings on that. Okay, I'm ready to sit down. Turn this back over to Laura, I think, at this point. So thank you again very much.